We continue to keep an eye both regionally and nationally on what other communities are doing.
At the local level and from the mouth of the governor, a common consensus: Ohio's vaccine rollout hasn't been good enough. According to CDC data updated Friday, 3.6% of the country has been vaccinated so far, but Ohio falls below the national average at just 3.2%. Kentucky sits at 3.9% and Indiana at 3.86%. West Virginia is in the lead, already vaccinating 7.5% of its population. That's double the national average.
The state took a very unique approach in using the National Guard as well as independent retail pharmacies to start to vaccinate the nursing home residents and workers and not waiting on the federal plan like most of the other states had done.
Todd Karpinski is the chief pharmacy officer with the state's largest healthcare provider. He explains the state's approach, the only state that didn't partner with CVS and Walgreens, but mom and pop pharmacies instead. National Guard members accept vaccine at mega hubs, take inventory, then distribute it.
They really coordinated that distribution and didn't leave it up to each individual hospital or retail pharmacy to do that. And I really think that's been a key at the rapid turnaround.
By all accounts, it's working.
We have the infrastructure to do tens of thousands of doses throughout the state. We just need the supply.
There are 50 different plans across 50 different states here. The one thing, unfortunately, that is common across all states is that we do not have enough supply.
Kate Schroeder was just selected for a new position with the Health Collaborative, coordinating efforts for the region's vaccine rollout.
I do think there is an opportunity to learn from each other, especially when you have such a rapid learning curve. And so this is something that really is on our mind as a region here, is how do we learn from the other states?
And I also want to point out there is a delay between when states are reporting on their own vaccine dashboards and when that information trickles to the CDC and they have access to it. States have a few days of cushion before they have to report their vaccine statistics to the CDC. Jatera McGee, WLWT News 5.